Next, we have two speakers. First, we have Brianna P. Lemmons. She joined Baylor University's Garland School of Social Work as an assistant professor in the fall of 2018. Dr. Lemmons is also a Minority Serving Institution Fellow with the American Evaluation Association and has extensive experience in the area of program evaluation, having served as an evaluator for organizations such as Concerned Black Men and the Dovetail Project, a teen fatherhood program in inner city Chicago. Previously, Dr. Lemmons served as an assistant professor in the School of Social Work at California State University, Los Angeles, and as an adjunct assistant professor and postdoctoral fellow at Howard University School of Social Work. Currently, her research focuses broadly on the structure and functioning of African American families, and more specifically on predictors of non-resident African American father involvement. Her future lines of research will explore the role of spirituality in fathering and effective pedagogies for delivering research-related content in social work programs. Dr. Lemmons received her doctorate in social work and master's in social work from Howard University School of Social Work and her bachelor's degree in psychology from Spelman College. We also have Dr. Latrice Rollins. Latrice Rollins is an assistant professor at Morehouse School of Medicine in the Department of Community Health and Preventative Medicine, where she embraces a community-based participatory approach for all projects she leads. Dr. Rollins is also a Robert Wood Johnson Culture of Health leader whose research is focused on father engagement, father inclusive practices, and women in fatherhood. She has also served as the Assistant Director of Evaluation for the MSM Prevention Research Center, where she has led the evaluations of research infrastructure, capacity building, and health promotion projects. Dr. Rollins was an award-winning program analyst for the U.S. Department of Health and Human Services Office of Inspector General, evaluating national programs that impact the most underserved populations. Dr. Rollins also worked for Georgia's Office of Child Support Services and the Georgia Fatherhood Program. She provides father engagement training for practitioners in various sectors. She is the editor and one of many authors of the book, Engaging African American Fathers, Strategies and Lessons. Dr. Rollins received a bachelor's in sociology from Spelman College and a master's and doctorate in social work from the University of Georgia.
All right. Well, good afternoon or good morning, depending on where you are. Thank you so much for having us to talk about women in the fatherhood space. This has been an amazing conference so far, just from what I've been able to hear this morning. So thank you again for having us. You can go to the next slide. And so as Dee Dee said, I am Latrice Rollins. I do serve as an assistant professor at Morehouse School of Medicine in Atlanta, Georgia. I also am proud to serve as the vice president of the Black Female Fatherhood Scholars Network. And I'll turn it over to Dr. Lemmons.
Hello, everyone. My name is Brianna Lemmons, and I am an assistant professor in the Diana R. Garland School of Social Work here in Waco, Texas at Baylor University. And I am the president of the Black Female Fatherhood Scholars Network. And so today, in terms of our objectives and what we'd like to share with you, we'd first like to give you a little bit of background on the Black Female Fatherhood Scholars Network in terms of who we are and what we believe. We'd also like to share with you why women. So the title of our presentation today, again, is called Women in Fatherhood Spaces. And so we want to just give some background and some context on why women, why is it that we have endeavored to do this work around women in fatherhood. So we want to give some context around that. And then we also want to share with you some women leaders in the field of fatherhood and some of the things that they have going on and how they're impacting this field in three areas: practice, policy, and research. And we also want to leave you with some tips and resources for women who are working in fatherhood spaces. So we know we have some individuals here on the call with us today that are probably women who are serving in fatherhood spaces. And we know that that can be challenging at times, and we're often challenged, and we'll talk about this in a moment, of what do you know, right, as a woman in doing this work in the field of fatherhood. It's not easy work, but it's necessary work. And so we want to leave those who are women working in these spaces with some tips and resources that you can draw upon in your work with fathers. And then we'll have some Q&A if anyone has any questions for us at the end. So in terms of background, who we are and what we believe as a network. So I just want to start by just saying what the impetus is for starting the network. So this for me was really the impetus is on three levels: personal, professional, as well as societal and cultural. And so for me, this work, first and foremost, is very personal. It really has to do with my relationship with my own biological father. And as you can see in the picture on the left there, that is my dad, with both of my sister and I simultaneously throwing temper tantrums. And so you can see, and that's me on the left there, back arched and all, just having a fit. I don't know what I was having a fit about, but I was upset about something. But I shared this picture just so that you can see, this is one of my fondest memories of my dad, and sort of how I remember him today as just being a very, very hands-on father, an involved father. But my dad also had a very complex past and relationship with his own family, his family of origin, in terms of his father not being present in his own life, his mother being an alcoholic. And we know that in many ways, oftentimes fathers in their role, as, even though they may not necessarily have had a father that was present, oftentimes men seek to, and I've heard several individuals today who have presented and shared with us talk about how they wanted to do things differently than their own fathers. And so that was my father's story as well. He really did not have a present father, and he often shared with me that the only memory that he had of his own father was his father giving him a wallet one day with $1 in it. And he was sitting in the back of the car with his father, and his father handed him the wallet, and he said, "Don't open the wallet." And my father, being the curious person that he was and still is, opened the wallet anyway against his father's wishes. And his father turned around and backhanded him for disobeying. And that's really the only memory that my father has of his own father. And so, you know, he really sought to be better than his own parents were to him. But at the same time, he really faced many barriers. And Mr. Solis talked about this in his presentation, some of the barriers, very real barriers that fathers face in being present. My father, I grew up knowing him to be both a resident father to my sister and I, but also a non-resident father to my siblings. I have 5 siblings. And so very blended family. And so I watched my father struggle to be a father to my non-resident siblings due to issues such as maternal gatekeeping. He had a very adversarial relationship with his co-parent, which in many ways prevented him from being present in the lives of my siblings on a regular basis, or in the way that he would have liked to be. He also experienced pressures to provide. So the child support system had a very large impact on the role that my father was able to play, because he was working multiple jobs trying to be sure that he met his child support obligations, which meant that he also had to spend a lot of time away from my non-resident siblings. And then again, his own father's absence in his life, and sort of not having the blueprint for what it means to be a present and involved father. And so again, very personal for me in terms of everything that I do within this network is really based on my own relationship with my father, as well as the struggles that I watched him face. Also from a professional standpoint, my experiences in working with inner city youth in Washington, D.C., I spent 12 years in that area. And I saw many of the young people that I worked with and how they struggled as a result of their fathers not being present in their lives. But on the flip side of that, I also saw what a difference it made for those youth that I did work with that did have a father that was present. I saw what a difference it made in their lives. So my professional experiences have also shaped the impetus for starting this network as well. And then finally, I've heard many touch on some of the social and cultural issues around particularly as it relates to Black fathers. So society's negative or deficit views around Black fathers, and them being the face of deadbeat and absent fathering. And we know that particularly when it comes to non-resident fathers, fathers that don't live in the home with their children on a full-time basis, historically, it has always been thought that these men, because they were not present in the home on a full-time basis, were in turn uninterested in being involved in the lives of their children or just simply uncaring. But we now know as a result of research that Black fathers, even if they do not reside in the home with their children on a full-time basis, are still very much so involved in the lives of their children. And so with taking into consideration all of these things, I really set out to change the narrative as it relates to Black fathers and really all fathers in general. And so I come at this work from a very strengths-based perspective and not so much what I didn't have with my father, but what I did have. And what I did see with those youth that I did work with in terms of the good things that fathers were doing in the lives of their children. And so I founded the Black Female Fatherhood Scholars Network on May 5th, 2020. And we are a network of Black female scholars. And I really want to just pause for a second and just say and share with you all how we conceptualize scholarship within the network. When we say scholars, we are meaning researchers, practitioners, and students. And Mr. Solis touched on this as well in terms of the detriment of operating in silos. And so my profession is, a lot of what I will say today is coming from through the lens of my profession, which is social work. And in social work, we talk a lot about how research informs practice and how practice is also supposed to inform research. And so what that implies is that we should be working in tandem together, researchers and practitioners. But oftentimes that doesn't happen for a number of reasons. And so we're trying to change that within the network by letting practitioners know that we need you in this work that we're doing. We can't produce good scholarship and good research without having the voices of practitioners, policymakers, community members, leaders, students, everyone at the table. And so really our definition of scholarship and what we mean by scholar is very broad. And so I want to be very clear about that. And so we are a network of Black female scholars who are committed to uplifting the Black community through the study of Black fatherhood and Black families. And so currently we have 22 members who are involved with our network. And we represent across these 22 members 9 disciplines and professions, including social work, public health, psychology, mental health counseling, family and public policy, and a number of other disciplines and professions. And we also span across 11 states, such as Texas, Maryland, Illinois, Oklahoma, and several other states as well. And so here, I just want to show this brief video clip that tells you a little bit more about who we are and what we are about. So I wanted to sort of start by framing our discussion by talking a little bit about this idea of Black women in fatherhood. As Black women doing this work in the field of fatherhood, we're often challenged and questioned about why we do this work, what we know about fatherhood, what we believe about fathers. We all have a stake in the Black family, and that as Black women, we understand and we know that we will never be men, but we all have a stake in the success and the well-being of Black families. And we believe that if we can strengthen Black fathers, we can in turn strengthen Black families. And so that's really foundational to our beliefs as a network. In addition, we also believe that there's a need for reconciliation work. And what we mean by this is that we know that historically Black men have not had favorable relationships with societal systems. And we also know that women are often at the forefront of those systems. And so we believe that Black men and the world need to see Black women standing in solidarity with them as a way of reconciling broken systems and righting historical wrongs. And so we believe that this work that we are doing as a collective is a part of the reconciliation process. We also believe that we offer a unique perspective on fatherhood. Clearly, we all see that we're all women. We enter this work as wives and confidants of Black men, as daughters of Black men, as mothers of Black boys and men. And this perspective, we believe, is needed in order to fully understand the impact that Black fathers have on society. We want to make space for representation of Black women in fatherhood, and we also want to be a source of encouragement for Black women to do this work unapologetically. Okay, so in addition to that, hopefully that gives you a little bit more background on who we are and what we are about. And then I'd like to say, just to speak on just why women in fatherhood in general, and just give a little bit more context as it relates to that. So here I have some statistics that I was able to pull from the US Bureau of Labor Statistics, and it really speaks to how women are truly on the front lines in the majority of helping professions. These numbers speak to the education and health services specifically, but as we can see overall across education and health services, 74.6% of the labor force is women. And then we see in educational services specifically, it's 69.5%, healthcare 77.8%, and social services 86%. Okay, so we know, and the numbers tell us, and the statistics show us that women are on the front lines. Okay, and so in terms of background literature, many men experience a variety of biopsychosocial challenges that often go undetected. And due to societal norms and internalized conceptions of masculinity, as Daryl spoke about earlier, some men avoid expressing their vulnerabilities and experience a variety of barriers related to help seeking. So we know that men, we already know off the bat that men have these challenges and they experience these challenges mentally, physically, and the like. And because of these challenges that they face, or these internalized conceptions of masculinity that we've spoken about earlier in the conference, this not only impacts family, but it also, and community, et cetera, and the like, but it also impacts their help-seeking behaviors. And so but those men who do seek help report feeling that helping professionals are ill-equipped and lack an understanding of the emotional, physical, interpersonal, and family problems that they face. Okay, and since we now know, and as I've just shared, we know that women are on the front lines of nearly all helping professions. So why women in fatherhood? We need women in this field who are equipped with the skills necessary for meeting the unique needs of men and fathers. And one of the arguments that I often make, and I'm speaking to my profession, which is social work, is that oftentimes in social work education programs, it is assumed, because the curriculum is more of a generalist curriculum and students are often taught to work with children in general, families in general, but there's no specific education around how to deal with the unique needs of men and fathers. It's just assumed that when students exit their programs that they have this knowledge, but oftentimes they're met with challenges, because the situations that we deal with today in the 21st century with the 21st century family and father is very complex, right? So how do you deal with a father who has multiple children by multiple women? How do you deal with a man who has lost access to his children due to divorce? So there are so many challenges that men face today that social work students in particular are not being equipped to really handle. And so that's one of the things. Our network is comprised of a number of faculty members across institutions across the US. And so that's very much so within our wheelhouse to tackle this issue of helping social work programs and other helping professions to understand the importance of including content on fathers in their curriculum, so that students are leaving these programs prepared to tackle these very complex and very important issues. And so the charge to women in fatherhood spaces, as it was spoken of earlier, we know that because the helping professions are being led primarily by women, oftentimes what we find is these implicit biases, oftentimes due to these relationships that women may have with their fathers or with their spouses or with the men in their lives. Oftentimes these biases go unchecked. And so we really need women in the field, in fatherhood spaces, that are willing to challenge these implicit biases, not only the ones that they hold, within themselves that often manifest in the work that they do, but also the implicit biases that exist within the system. We heard Mr. Solis talk about this in terms of understanding that there are these very unconscious, very implicit biases that are embedded within the systems that fathers are often interacting within. And so we need women who understand the unique aspects of fatherhood and the unique aspects of these very insidious biases that often occur within systems. And we need individuals that are willing to challenge these biases and the deficit paradigms that are out there about men and fathers. We also need women that are able to model appropriate, positive, and affirming interactions between women and fathers. We need women in the field of fatherhood that are able to change the narrative and also to reconcile broken systems and right historical wrongs, as I mentioned in the video that we just shared. So now I'm going to turn it over to Dr. Rollins, who is going to talk about women leaders in the field of fatherhood.
Thank you, Dr. Lemmons. So we just wanted to be able to highlight a few women in the field. There are so many, honestly, and we've just selected a few just to give you all some ideas of what women are doing in the fatherhood field, and just to give them some shout out, give them some love for the work that they're doing. You can go to the next slide. Okay, Sherry Tillis, she is the Executive Vice President and COO of Fathers and Family Support Center, which is in St. Louis. This is an entire center that's devoted to providing services and support to fathers. And she is the Executive Vice President of such. Next slide. Samantha Fields Daniels, she is the co-founder of Fathers Uplift in Boston, Massachusetts. They provide mental health counseling, coaching, and advocacy to assist fathers with overcoming barriers that prevent them from remaining engaged in their children's lives. They also reach out to children who are growing up without their fathers and provide mentoring and various outings and also counseling to these children. Next slide. We also want to look at some women who are in the policy realm of fatherhood. And Lisa Nkanoki is one who founded the Dads Do Make a Difference campaign and was one of the only women that was invited to be a witness and provide testimony to the Ways and Means Committee hearing on fatherhood back in 1999 to support the Fathers Count Act of 1998. Now that act did not pass, but that testimony did lead to them continuing to press this issue. There was, Fathers Count Act of 1999, and they kind of continued to put this act on the forefront to support fathers and provide funding to fatherhood programs. Go to the next slide. Dr. Patrice Sams-Abiadun, we worked together to develop this Fathers, Families, and Community Policy Brief Series. That policy brief series was an impetus for the Fatherhood First Initiative legislation in New Orleans, Louisiana. That legislation created the Fatherhood First Council, which was led by the Department of Children and Family Services there. It also served as a catalyst for 5 new fatherhood programs in Louisiana. It also initiated the alignment and coordination of service delivery, resulted in greater investment in the New Orleans Fatherhood Consortium, and helped to inform the mayor's agenda around children and families. Next slide. Jacqueline Boges, she is the Executive Director of the Center for Family Policy and Practice. They also have a number of various policy briefs and research that they conduct to really remove the unique barriers and negative public perceptions that affect low-income men of color. Next slide. Kimberly Dent, she is the Executive Director of the Ohio Commission on Fatherhood. This is such an innovative, governmental agency that is really focused on fatherhood, and she is one of the leaders of that. They help to provide funding to responsible fatherhood programs in Ohio, as well as make policy recommendations within the Ohio Department of Job and Family Services. Right.
Okay, so I'm going to say a little bit about women leaders in fatherhood, specifically women who are doing research in the area of fatherhood. So the first person that I'd like to share with you is Dr. Shauna Cooper. She is an associate professor of psychology at UNC Chapel Hill, and she runs a lab called, it's a research lab called Strengths, Assets, and Resilience Lab. And we'll share these slides with everyone following the presentation, but I've provided the link to her lab, and some of the projects that she has going on right now in her lab that are specifically focused on fathers include understanding how mothers and fathers negotiate race-related discussions. And within this particular project, she examines agreement and consistency between fathers and mothers' ethnic racial socialization practices. She has another study going now that's called Fathers and Mothers in the Lives of Youth. And this particular study aims to investigate determinants of African-American fathers' parenting practices. And finally, she has another study called the Family Study. And this particular study is focused on investigating and examining African-American fathers' parenting practices and some of the factors that contribute to how African-American fathers parent their adolescent children. And the second researcher that I'd like to share is Dr. Kiana Cryer-Coupe. She is an associate professor of social work at North Carolina State University, and she runs a lab called the Whole Dad Lab. And I've also provided a link to her lab as well if you'd like to learn a little bit more about some of the projects she has going on. I've actually worked with Dr. Cryer-Coupe on several different publications, and we're also currently working on a book that is called Social Work Practice with Fathers, Assessment, Engagement, and Intervention. And that book is due to be out in May of 2022. But one of the studies or projects that I'd like to highlight, which I thought was very innovative and creative, is she calls it Papa Was a Sneakerhead. And this particular, and we know that many Black fathers, are very much so involved in the sneakerhead culture with all the Jordans and all the different sneakers that fathers are purchasing. But oftentimes we don't think about it in the context of how these kinds of things help them to bond with their children and how this kind of builds a culture within the family. And so they really look at the impact of consumer behavior on parenting practices of Black fathers via the lens of the sneakerhead culture. And she was able to get some publications out of this work that are currently out there and available, looking at sneakerhead culture within Black families. And she was also able to capture some of the images with fathers and their children with some of the sneakers that they, matching sneakers that they have together and things of that nature. So this was a very, very innovative and unique project that she has engaged in. And then I'd also like to mention another project of hers called Understanding the Experiences and Needs of Fathers in Kinship Care. And within this project, she focuses on the fathering experiences of men with children living in kinship care.
Great. So now we want to just speak a little bit about some tips for women working in the fatherhood space. This particular graphic is showing the competencies that we think women should have as women working with fathers. And in fact, it really doesn't just apply to women, but really all practitioners. But looking at just making sure that there are knowledge, skills, and mindset that is set in a way that you can appropriately and effectively serve fathers. And so in terms of knowledge, really looking at this historical discourse around father involvement and how it has changed over time, as we've seen in other presentations, just with the different generations. We started out with kind of this fathers know best idea way back, when, and now we've kind of changed to something else. And so we just really need to understand kind of how the history of father involvement has evolved over time. Also understanding the parental roles, just those different socially constructed roles, honestly, for various parents, and just understanding how fathers may interact differently than mothers with their children, and how those both should be appreciated. Being aware of the fatherhood research, as well as the different theories. So understanding the research that's been conducted, as Dr. Lemmons just talked about, different very innovative interventions, and different clinical and educational interventions that have been done that have been successful with fathers. Also understanding the various theories around father involvement, around father identity and formation, around how culture impacts fatherhood, just having those different knowledge of those different theories and how they impact practice will really help women working in these spaces. Also, an area that was very interesting to me was around power dynamics and understanding how issues of power, such as race, gender, social economic status, how they impact the helping relationship. As you know, we've been talking about, we have to understand where we are and our mindsets and things as practitioners. You know, understanding that we hold a certain amount of power as practitioners, as providers, physicians, whatever kind of space you're in as a professional, and knowing how to manage that such that you can develop that rapport and develop that helping relationship is something that will, you know, bode well for you in working with fathers. In terms of the skills that are necessary, the cultural humility is key, you know, just not assuming anything about anyone's culture or background, but really being humble and understanding, asking questions and getting a great understanding. Communication, understanding the various ways that men may communicate differently from women, not being afraid of the ways that men communicate. Those are different things that you know, just have to learn as a practitioner in engaging men. Also not, you know, one of the things is being authentic in terms of your communication, not using a whole lot of jargon, but also not, you know, being inauthentic and trying to use a lot of slang that is not really the way that you speak and all of those things. So just, you know, being aware of the various communication skills. Embracing participatory strategies or in various engagement strategies to engage fathers is key. You know, partnering with them, understanding that this is not your family, this is his family that you're helping him with. And so partnering with them and not coming in as an expert, but more so as a facilitator, as a resource is going to bode well in terms of building that rapport. Resource brokering and service navigation is going to be key. I'm sure you all have heard of the various types of challenges and barriers that fathers face, and it's very hard for all of those things to be addressed within one program. And so it's important for practitioners to understand and know the landscape of services that are available specifically for fathers and being able to help them connect and link effectively with those different practitioners and services to meet their unique needs. Interprofessional collaboration is also another one we've continued to say, and if you don't take anything away from this morning, certainly do not work in silos. Interprofessional collaboration is key. We have to work across you know, various professions, whether it's social work, public health, medicine, business, employment. We have to work across these different sectors to be able to effectively meet the needs of fathers. And then in terms of mindset, as we've been talking about, just self-checking and being aware of our own biases and aware of our own issues, also helping others in our team. We can certainly impact the culture of our organizations to be more supportive, to be more father inclusive. So when you hear another coworker speaking negatively about a father or something like that, you can certainly call them out on it and make them aware of the biases and the different things that they're bringing up. So being self-aware as well as, you know, being that check for others. Also embracing a strengths and assets perspective with fathers. As Dr. Lemmons talked about, we really focus on father presence. We focus on father engagement, not, you know, father absence as much. You know, we really want to support fathers and make sure that the barriers are not there when they're trying to do the best that they can to be involved. We want to address those barriers. We don't want to turn around and talk about, you know, what they're not doing or whatever. We want to look at the resources and the assets that they bring and that they are to their children and to their families and communities. I like ethical because, you know, with anything else, when we have so much research and evidence that shows something works, we make sure that we put it into practice. And so I like to say that engagement, father involvement is an ethical issue. If we are not making sure that we're engaging and including fathers in services, we're not being ethical in our practice. We have to make sure that, if we understand that when dads are engaged, we have positive health outcomes, we have positive academic outcomes, positive emotional outcomes, then we should be doing what we can as practitioners to make sure that they are positively involved. So I like to think of it as an ethical issue, as well as being professional. That goes back to mitigating our own biases and making sure that we're not putting our own issues onto the families and fathers that we serve. So while we do have, as Dr. Lemmons talked about, we both have personal and, very close relationships with our own fathers and other family members that are men. We certainly, when we're addressing clients and doing our research, we still have to have a very professional mindset in knowing that, we have to handle things in that way and not let our biases get in the way of the person that's sitting in front of us. Next slide. So these are just some other resources specifically that focus on educating women about working with fathers. So the Best Start Resource Center, they have a free online ebook that really any practitioner can look at and learn from, but they have a special section particularly for women who are working with men. Also, the National Fatherhood Initiative, they have an ebook on educating female staff to effectively engage fathers. I'm stumbling over the word train because my my dissertation chair, she always says training is for animals. We educate people, so it's tripping me up a little bit. So how we work with female staff to effectively engage fathers. And so they, in that free ebook, they talk about the various products that they have available with the National Fatherhood Initiative that you may want to use as you approach working with female staff and how they can better engage fathers. And then finally, my book that I edited on engaging and working with African-American fathers, strategies and lessons learned. This is probably the only book that is authored by all women talking about their experiences working with a number of different African-American fathers. So these are African-American fathers who are in the maternal and child health space, who are Alzheimer's caregivers. This is Brain Awareness and Alzheimer's Month. June is Alzheimer's Awareness and Brain Memory Month. So we do have a chapter on that. We also have chapters on women working with fathers in the in battering and in domestic violence programs and substance abuse, mental health. So just looking at, how these women engage the fathers, what were some of the strategies that they used, what were some of the different interventions and programs that were in place, and just some of the lessons that they would like to share in terms of encouraging women to reach out to men in these various spaces. And so this is kind of the conclusion of our presentation on women in fatherhood space. You have our contact information there, our various emails, as well as our administrative assistant for the Black Female Fatherhood Scholars Network, Shanice Johnson. And so at this time, we're happy to answer any questions or hear any comments that you all have for us. Thank you so much for this opportunity.